Welcome to the Fields of Code tutorial series, and to this tutorial, Collecting Medical Information. Begin by opening the patient's gateway. Look for the patient file you want to update in the list. Use filtering to quickly find the person that you're looking for. Select it and press the Open button. You are about to log medical information on the HX page. In this example, the assumption is that you are sorting the data after the initial questionnaire filled out by a new patient when he or she joined your clinic. If the patient reports an allergy to latex and local anesthetic, you will need to choose the Add Allergic Substance button on the top toolbar. Select the latex and local anesthetic phrases in the list. Hold down the Control key on your keyboard while clicking to select over the second time. Press the Accept button. You can now see your choices in the Allergies section. Let's say the patient also reported to have conditions, asthma for example. To log it, press the Add Medical Conditions button on the toolbar. I see that this term does not appear in the dictionary, so I will have to add it first. Press the Add New Entry to Dictionary button found below the list. The system brings you to the Lookups view, specifically to the Medical Conditions Dictionary. Press the Add button, type asthma, and click OK. Save this page. Then use the Windows menu to return to the patient document you were working on before. You will have to press the Add Medical Conditions button again to reopen the list you were working on. You should be able to see it this time. Select it and press the Accept button. The illness is added to the patient's medical conditions. Having asthma, the patient also reported using medication. Click the Add Medication Types button at the top. Scroll down the list and select Ventolin, for example. Press the Accept button. You should see this selection in the Current RX and Over-the-Counter Medications section. Consequently, the page header is geared with several icons that hint at the types of data collected. If you hover your mouse over the top left corner of the page, you can also observe these alerts as flyover text. These will help you keep in mind that there could be special considerations. Their greatest use is that you can always see them regardless of the page you navigate to, not only from the HX page. I will browse through for a moment to show you that every page shows the same flags at the top. If the patient is immunocompromised, you should check the related box. Notice how with each newly selected concern, a new icon appears. When the patient has medical conditions that could impact the types of prescriptions permitted, you could also check the third box to create the necessary warnings on the corner of every page in this document. If you already know who will be the physician to take care of the patient, most of the time you can make a note of it here as well. Press the Select a Default Healthcare Provider for this patient button to gain access to the employees list. Another very important piece in collecting the patient's medical history is the list of names containing all the family physicians and specialists treating this patient, as well as the person to contact in the case of an emergency. To find out more about how to make a record of these persons and healthcare providers, watch the Collecting Information About Specialists and Emergency Contacts video tutorial. Let's take a look at how to make corrections. If I made a mistake in the allergies list, and I want to remove the local anesthetic allergy, for instance, I would remove the check mark from the associated box. The system requires the choice to be confirmed before actually removing it. You probably noticed that the patient file contains a separate page that is marked as RX. You might be thinking, why then are we logging medication here? The RX page is there to record all prescriptions that will be issued to the patient by this clinic. This is the case whether those prescriptions require special considerations or not. On the other hand, the medications logged here on the HX page were either started before the patient joined the clinic or are new but prescribed by other physicians or specialists. You would only create an entry on this page for a matching record from the RX page if you wanted to set up a visual alert for that prescription. It may not even be important what the exact RX was, but rather the type of the medication, such as blood thinners, for instance. To find out more about issuing RX to your patient, watch the Writing Prescriptions tutorial. This concludes the Collecting Medical Information tutorial. I hope you found this information valuable. Thank you for watching.